The first signs of pancreatic disease. Pancreatic cancer is the third leading cause of cancer-related deaths, surpassing even breast cancer in some countries. And yet, over 90% of people can't name a single symptom of pancreatic disease. Could you? Your pancreas works tirelessly behind the scenes every single day, playing a crucial role in your digestion and blood sugar regulation. But what happens when this silent worker starts to fail without you even noticing? Think about it. Do you often feel more tired than usual, experience unexplained weight loss, or have occasional abdominal discomfort that you just shrug off as normal? You might be surprised to learn that these could be the first whispers of a far more serious condition. Research shows that nearly 70% of pancreatic cancer cases are diagnosed at an advanced stage, primarily because the symptoms are so subtle. In fact, it's known as the silent killer, because many people don't even realize there's a problem until it's too late. But what if you could spot the signs early enough to make a difference? In this video, we'll explore these lesser-known symptoms and more, breaking down what you need to watch out for and why it matters. We'll help you understand what these early signs are trying to tell you, so you can take action before it's too late. Stick with us, because understanding these symptoms could be the key to saving your life or the life of someone you love. Before we start, remember that the information provided in this video is for educational purposes only and is not intended as medical advice. Always consult with a healthcare provider for advice tailored to your health needs. The information provided is fact-checked, reviewed, and verified by qualified health experts. Sign 1. Persistent upper abdominal pain. Persistent upper abdominal pain is one of the early signs of pancreatic disease that is often overlooked or mistaken for something less serious. The pain usually presents itself in the upper abdomen, just below the rib cage, and can sometimes radiate to the middle of the back. This discomfort isn't the kind that comes after a heavy meal or too much exercise. It's a more constant, nagging pain that doesn't seem to have a clear cause. Some people describe it as a dull ache, while others feel it more sharply. What's tricky about this pain is that it can come and go, making it easy to dismiss as just another everyday ache or pain. But here's why it matters. A study published in The Lancet in 2020 found that over 70% of patients with early-stage pancreatic cancer reported experiencing intermittent upper abdominal pain before their diagnosis. That's a significant number of people who had this pain as an early warning sign. The pain happens because, as a tumor grows in the pancreas, it can press against surrounding nerves or nearby organs. Think of it like this. When something that shouldn't be there starts pushing against delicate parts of your body, it causes discomfort. And if the tumor is located near the bile duct, it can create a blockage that disrupts digestion, leading to even more pain and discomfort. If you've ever had abdominal pain that seemed to come out of nowhere and doesn't go away or keeps coming back, it could be more than just a bad case of indigestion. It's worth paying attention to these signs, especially if you notice other symptoms that don't feel right. Sign 2. Unexplained weight loss. Another major sign to watch out for is unexplained weight loss. Now, we all know that losing weight is something many people strive for, but when it happens suddenly and without any effort, it could actually be a red flag. If you find yourself shedding pounds without trying, no new diet, no extra exercise, it might be a sign that something isn't quite right with your body. Unexplained weight loss is a symptom often linked to pancreatic disease. When the pancreas isn't working properly, it doesn't produce enough enzymes to digest food efficiently. This leads to malabsorption of nutrients. In other words, your body isn't getting the fuel it needs from the food you're eating. According to the American Cancer Society, rapid weight loss is a common symptom in about 80% of patients diagnosed with pancreatic cancer. When your body isn't absorbing nutrients properly, it begins to burn fat and muscle for energy, leading to weight loss. It's like your body is in survival mode, using whatever it can find to keep going because it's not getting what it needs from your diet. Sign 3. Jaundice, yellowing of skin and eyes. Jaundice is another key sign that can indicate pancreatic disease, and it's one you should definitely be aware of. Jaundice happens when there's a buildup of a substance called bilirubin in your blood. Bilirubin is a yellow pigment that's created when red blood cells break down. Normally, the liver processes bilirubin and it gets passed out of the body. But when something disrupts this process, bilirubin starts to accumulate in the blood, causing the skin and the whites of the eyes to turn yellow. One common reason for jaundice in the context of pancreatic disease is when a tumor grows in the pancreas and blocks the bile duct. The bile duct is like a small tube that allows bile, which contains bilirubin, to flow from the liver to the small intestine, where it helps digest food. When a tumor blocks this duct, bile can't drain properly, and it starts to build up in the bloodstream, leading to that yellowish color of the skin and eyes. Research from Johns Hopkins University in 2018 found that jaundice was actually the first noticeable symptom in about 50% of patients with pancreatic cancer. This means that for many people, the first clue something was wrong with their pancreas was their skin or eyes turning yellow. But jaundice doesn't just affect how you look, it can also come with other symptoms. You might notice that your urine turns dark, almost like tea or cola, while your stools become pale or clay-colored. Some people also experience intense itching, which is due to the bilirubin accumulating in the skin. Sign 4. New onset diabetes. Another important sign to watch out for is the sudden onset of diabetes, especially if there's no family history or other obvious risk factors like obesity or age. New onset diabetes can actually be an early sign of pancreatic disease. The pancreas is responsible for producing insulin, the hormone that helps regulate blood sugar levels. If a tumor starts to develop in the pancreas, it can interfere with this function, causing insulin production to drop or become erratic. This can lead to higher blood sugar levels, which is essentially what diabetes is. According to a study published in JAMA Oncology in 2021, about 40% of patients diagnosed with pancreatic cancer had developed new-onset diabetes in the months leading up to their diagnosis. This suggests that if you or someone you know suddenly develops diabetes without any clear reason, it's worth considering that there might be something more going on. Sign 5. Digestive problems. Nausea, vomiting, indigestion. Digestive problems like nausea, vomiting, bloating, and indigestion can often seem like minor issues, but when they start happening frequently or without a clear cause, they could be a sign of something more serious. In the case of pancreatic disease, these symptoms often occur because a tumor is blocking parts of the digestive system. When there is a tumor in or around the pancreas, it can press on the small intestine or stomach, causing a partial blockage that leads to nausea or vomiting, especially after eating. A 2019 study from the Mayo Clinic found that over 60% of patients with pancreatic tumors reported digestive issues months before their diagnosis. This is why it's so important not to dismiss these symptoms, especially if they're new or don't seem to have any obvious cause. If you find yourself regularly feeling nauseous or bloated after meals, particularly after eating fatty foods, it's a good idea to talk to a doctor. These could be early warning signs of a blockage in the digestive tract caused by a tumor or the pancreas not producing enough enzymes to do its job properly. Sign 6. Changes in stool appearance. Changes in stool appearance can also be an early indicator of pancreatic disease. If you notice that your stools are oily, light-colored, or float and have a foul smell, this could mean that your pancreas is not producing enough enzymes to break down fat properly. This condition, known as steatorrhea or fatty stools, occurs because fat isn't being absorbed correctly by the body. As a result, it ends up in the stool, giving it an oily or greasy appearance. According to a report by the Pancreatic Cancer Action Network in 2020, steatorrhea is a common early symptom in about 80% of pancreatic disease cases. This happens when a tumor in the pancreas interferes with its ability to produce digestive enzymes, specifically lipase, which is responsible for breaking down fats. If your body isn't getting these enzymes, the fat from your food doesn't get digested and absorbed the way it should, leading to these noticeable changes in your stool. Sign 7. Fatigue and weakness. Persistent fatigue and weakness are also common early signs of pancreatic disease. When your body isn't absorbing nutrients properly, it doesn't get the fuel it needs to function efficiently. This lack of nutrients can lead to a feeling of constant tiredness, no matter how much rest you get. The pancreas is essential for producing enzymes that help break down food and release nutrients into the bloodstream. When it isn't functioning well, these enzymes aren't produced in sufficient quantities, and your body essentially starts running on empty. Research published in the British Journal of Cancer in 2018 highlighted that fatigue and weakness were among the most reported early symptoms by pancreatic cancer patients. If you often feel exhausted even after a full night's sleep, or find yourself running out of energy quickly throughout the day, it could be more than just a sign of a busy lifestyle. It's worth considering whether there might be an underlying issue, such as a problem with your pancreas, that is affecting your body's ability to absorb nutrients properly. Today, we've discussed the early signs of pancreatic disease, including persistent abdominal pain, unexpected weight loss, jaundice, new-onset diabetes, digestive problems, changes in stool appearance, and fatigue. Recognizing these symptoms early could be crucial to preventing more serious complications. So what was the most surprising symptom you learned about today? Have you or someone you know experienced any of these signs? We'd love to hear your thoughts in the comments below. Your feedback is incredibly important to us. Remember, if you or someone you know is experiencing any of these symptoms, don't wait. Seek medical attention immediately. And don't forget to subscribe so you don't miss out on our upcoming health videos and other tips to healthier, happier life. Please like, share, and leave a comment. Embrace a healthier you with fresh insights, nutritious tips, and vibrant wellness journeys. Stay fresh, stay healthy. See you next time.